Exposure therapy is a type of behavioral therapy that is commonly used to treat anxiety disorders. It is based on the idea that by gradually exposing individuals to the situations or objects that they fear, they can learn to manage their anxiety and reduce their symptoms. In this video, we will explore the principles and techniques of exposure therapy in detail. Exposure therapy is based on the principles of classical conditioning, which involves learning through association. In classical conditioning, a neutral stimulus, such as a sound or a sight, is repeatedly paired with a stimulus that elicits a particular response, such as fear. Over time, the neutral stimulus becomes associated with the response and can elicit the same response on its own. In exposure therapy, the feared stimulus is the neutral stimulus. By gradually exposing the individual to their fear, without any negative consequences, they learn to break the association between the stimulus and fear. This process is called extinction. Extinction occurs when the individual no longer experiences anxiety in response to the feared stimulus. The goal of exposure therapy is to help the individual face their fears and reduce their anxiety symptoms. This is achieved by gradually increasing the intensity and duration of exposure to the feared stimulus. Here are several techniques used in exposure therapy. These include systematic desensitization. This involves gradually exposing the individual to the feared stimulus, starting with a situation or object that causes only mild anxiety, and progressing to more intense stimuli. The individual learns relaxation techniques, such as deep breathing or progressive muscle relaxation, to help manage their anxiety. In vivo exposure. This involves exposing the individual to the feared stimulus in real-life situations. For example, someone with a fear of spiders may be asked to handle a spider or visit a room full of spiders. Imaginal exposure. This involves imagining the feared stimulus in detail. For example, someone with a fear of flying may be asked to imagine a flight in vivid detail, including takeoff, turbulence, and landing. Virtual reality exposure. This involves using virtual reality technology to simulate the feared stimulus. For example, someone with a fear of heights may be asked to use a virtual reality headset to simulate standing on a tall building. The process of exposure therapy involves several stages. These include assessment. The therapist assesses the individual's anxiety symptoms and identifies the feared stimulus. Planning. The therapist works with the individual to develop a plan for exposure therapy, which may involve one or more of the techniques described above. Exposure. The individual is gradually exposed to the feared stimulus. This exposure may be in vivo, imaginal, or virtual reality, depending on the plan developed in the planning stage. Monitoring. The therapist monitors the individual's anxiety symptoms during exposure and provides support and encouragement as needed. Review. The therapist reviews the individual's progress and adjusts the exposure plan as necessary. Exposure therapy has been shown to be effective in treating a wide range of anxiety disorders, including generalized anxiety disorder. This is characterized by excessive worry about everyday situations and events. Panic disorder. This is characterized by recurrent panic attacks, which are sudden and intense episodes of fear. Social anxiety disorder. This is characterized by excessive fear of social situations and performance anxiety. Specific phobias. These are intense and irrational fears of specific objects or situations, such as spiders, heights, or flying. Exposure therapy has several benefits compared to other forms of therapy. These include: it is effective. Exposure therapy has been shown to be effective in reducing anxiety symptoms in the majority of individuals who receive it. It is relatively short. Exposure therapy is typically shorter than other forms of therapy, such as psychoanalytic therapy, which can take years. It is cost-effective. Exposure therapy is often less expensive than other forms of therapy, as it requires fewer sessions. It is focused. Exposure therapy is focused on the specific fear or anxiety, rather than on broader issues that may not be relevant to the individual's symptoms. It is empowering. Exposure therapy helps individuals face their fears and develop coping skills to manage their anxiety symptoms. It has long-lasting effects. Exposure therapy has been shown to have long-lasting effects, even after treatment has ended. Exposure therapy is generally considered safe, but there are some risks and limitations to be aware of. These include: it can be distressing. Exposure therapy involves deliberately exposing the individual to a feared stimulus, which can be distressing and uncomfortable. It may not work for everyone. Exposure therapy may not be effective for everyone, particularly for individuals with severe anxiety or those who are not willing to participate in the treatment. It may have side effects. Some individuals may experience side effects, such as temporary increases in anxiety symptoms, during exposure therapy. It requires a skilled therapist. Exposure therapy requires a skilled therapist who can guide the individual through the process and provide support and guidance as needed. It is important to be aware of the risks and limitations of exposure therapy, and to seek the guidance of a skilled therapist if considering this treatment option.